This discussion post um, is going to cover HIV infection and prevention, both on a national or local um, stage and a international uh, stage. So first, I want to talk about what we're doing in the United States to help stop the spread of HIV. Um, so national goals for HIV and infection prevention, they involve the enactment of a movement called the EHE, which is short for the ending of HIV epidemic in the United States. It was first signed into act in 2019, and the basis of EHE is to use the four different scientific processes that have been proven to work as far as disease prevention and treatment is concerned. First is to diagnose, which would involve making sure that people are getting tested. So, spreading the word and making sure that we are advocating for patients to be tested, even if the chances of them having HIV is low. HIV testing is still very important because you can't rule out anybody as far as HIV is concerned. It can affect anybody. Um, treatment treatment involves they have all kind of medications now that you can take to help treat the HIV virus to make sure that it doesn't develop or progress into autoimmune deficiency, also known as AIDS. They are really honing in on the combination drugs that are being used because they are um, very successful in managing the disease and almost curing the diseases to the point where if the person takes their medicine every day like they are supposed to, most likely they will live a very long and healthy life and die from something completely unrelated to their HIV infection. Um, and most of the time, if you test a patient who is taking a combination medication for HIV, the test will come back undetectable for the virus. Um, it's important that they know that to keep taking the treatment every day for the rest of their life because if they don't, then the virus can um, become more prevalent in their system again and cause more problems. Um, the third one is to prevent it from being a problem in the first place. It's an endemic right now. Um, it's been for a long time now, at least 30 years. So prevention is key, and that's important. That's a part of this act is to teach people to have safe sex, initiate partner screenings before you decide to have relationships with somebody without using protection. And then the last part of it, the last four of the scientific processes that they recommend using is the response. Respond to the endemic of HIV with things like this act that was put into place. They chose to do it on 57 of the most highly infected jurisdictions in the United States. Um, and they're doing this with the hopes of reducing the amount of HIV, of new HIV infections that we are seeing. They also hope to treat the patients who are already or were previously diagnosed, treat them to where they're getting undetectable. And like I said, it was started in 2019, and they had an initial goal of by 2025 of reducing the amount of infections by 75%, and with an additional goal of um, a total decrease of 95% by 2030. The international and global aim is to decrease the amount of HIV infection that we're seeing across the globe. It's the same as the US. Everybody wants to decrease the amount of new infections, increase the amount of people being tested for these infections, as well as treat the people who are already infected with successful treatments, making sure that they have a good quality of life. The global aim work, that global aim is using something called the Accountability Framework Act in order to continue efforts to decrease the effect of HIV on a global level. Um, Internationally, the goal is to diagnose at least 95% of HIV infected people, which is harder than it sounds. 95%. You would virtually have to know every person that is infected with HIV status, and that, I don't know how they plan on doing that. They would have to be violating some people's health rights, because most people do not go to the doctor. And when they do, most people do not consent to HIV testing because of the stigma that is attached to it. Most men don't want to be tested because they don't want people to think that they're gay. And most women don't want to be tested because they don't want to believe that they have been associating with somebody who would have HIV. So that is a hard goal um, for the World Health Organization to accomplish. And just like the U.S., they had a plan to accomplish this goal by 2031, and it started in 2019, and they had one benchmark of 2026. And then they started again in 2026 that will go through 2031. Um, but yeah, that's their global aim. They also globally are hoping to increase the amount of research that's being conducted on the HIV virus. The AACN essential that I can apply to this activity, or I chose to apply, is the 3.1F. It says develop an action plan to meet an identified need, including evaluation methods. It's basically saying we just need to know what we need to do, how we need to do it, make a plan, set benchmarks and goals, and then later on reevaluate if it was a success.